Hi there, and welcome. My name is Jeff Bell, and on behalf of McLean Hospital, I'd like to thank you for joining us for yet another episode of our educational video series. Today, we focus on strategies for supporting someone struggling with anxiety. Simply recognizing and relating to another person's anxiety can be difficult, and knowing what to say or do can be especially tricky. So, our guest today is going to offer some tips on both of those fronts and more. He is Mark Longsjo, a licensed independent clinical social worker and senior director of McLean's Southeast Campus. Mark, thanks for joining us.
Hi, Jeff. Good to see you again.
Well, good to have you back with us. Before we dive too deeply into supporting somebody with anxiety, let's talk about anxiety itself, the big picture. For example, not all anxiety is bad, right? Can you help us differentiate between what we might call everyday anxiety and more unhealthy anxiety?
Oh, sure. That is a good place to start, Jeff. Thank you. I think it is important to know that anxiety can be healthy. It's okay to have temporary worry. It's okay to have temporary fear, actually. It is something that makes us who we are. Now, when that becomes more long term and affects us in different ways, disrupts our lives over more time than just would be considered a couple of weeks or a couple of months, then that separates it into something that may require some treatment and some help.
Putting another fine point on things here, we talk about anxiety and anxiety disorders. What is the key distinction there?
Well, the key distinction there is really um, how it disrupts our lives. So, anxiety, can be temporary. We may be worried about something for a temporary period of time, and that would be normal. And then what ends up happening to make it more of a criteria for an anxiety disorder, it really lasts over time. And there can be a variety of symptoms, whether they be anxious thoughts, anxious behaviors, but if they last over time, that could be a sign that you need some extra support and help.
Just by way of perspective, do we have an idea of roughly what percentage of the population, for example, deals with anxiety disorders?
It's very common. In fact, what I saw most recently was that up to 18% of Americans are dealing with an anxiety disorder. It's probably the most common of our mental health issues going on in our country today.
And what are some of the more common types of anxiety disorders? Can you walk us through those?
Sure. Well, probably the most common one is generalized anxiety disorder. And it is estimated that 1 out of every 8 adults is dealing with generalized anxiety disorder. And it is kind of like, as the name describes it's generalized. So often people will explain it feeling like they're just out of control about feeling about their fears and concerns about everyday life, work, money, relationships, family, right? So any of those topics can actually, become such a difficult thing to work through every day that it makes people feel out of control. Their lives are disrupted. They're avoiding things. It can contribute to depression too.
Okay, so that's generalized anxiety disorder. What about panic disorder? We hear about that sometimes.
Sure, panic disorder. Now, that is the experience that somebody has when they get a rush of adrenaline. It comes out of the blue for the person, and it is quite scary. It comes with some physical symptoms, increased heart rate, sweating, palpitations. It's actually very scary for the individual, and it feels like it comes out of the blue as a rush.
Social anxiety disorders?
Social anxiety disorders, those are more about being fearful of going into situations where you feel judged, where you feel like people are watching you, where you feel uncomfortable in a situation. Now, that could be as simple as going out to the grocery store, or it could be going to work where you know you have a really difficult meeting ahead of you. But social anxiety is very real for so many of us. And uh, over time, if those symptoms persist, yes, it can be a diagnosable disorder, really requiring professional treatment intervention.
We sometimes hear the term separation anxiety disorder. What is that referring to?
Separation anxiety is a little more common for our youth, right? We hear about it mostly when it refers to the kids when they're having trouble separating from their parents or guardians. So we know that separation anxiety may start at a younger age, but it also can contribute to some of the other anxiety disorders as we get older. And some of those experiences that we have when we're younger, they do take us into our adult years, and without intervention can persist.
Phobias, do they fall under that anxiety disorders umbrella?
Oh, for sure. Yep. Those are more specific, and phobias are more specific to certain things. So, for example, we were just talking about social anxiety, but actually there is a phobia called agoraphobia. It's literally translated to fear of the marketplace. But it is so crippling that it keeps people from leaving their homes. And agoraphobia is one of those more specific disorders. You may have heard of other phobias related to fear of blood or fear of spiders, fear of insects. And those are all very real, but pretty specific and can be disruptive to people's lives.
Okay, I have a very specific question, one that sometimes causes confusion. OCD, as I understand it, is not technically an anxiety disorder anymore. That by definition, that has changed with the DSM, if I've got that right. Um, what should we know about OCD, and what is the distinction between it and anxiety disorders per se?
Well, that's a good point. That's a really pretty relatively recent development. I think we've always felt as though it's in that same category because a lot of the symptoms can feel the same. Ruminations and obsessions and compulsions can feel a lot like anxiety. So it's a little bit hard to say that they're mutually exclusive. I think we can still say that they're related. However, the behaviors, the compulsions, and the rituals are really what set it apart. And they require specific intervention from specialists, people who are specialized in OCD treatment.
And I realize I just used a term that some folks might not know, DSM. Can you explain what that is and how it's used within the mental health profession?
Oh, sure. The Diagnostic Statistic Manual, DSM. We're now in our fifth edition, and it really is a comprehensive review of all symptoms and helps us to understand how to meet the criteria for certain diagnoses. Very helpful to us in the mental health professions.
So let's take a step back now and talk about anxiety in general and ways that we might spot it in others or ourselves for that matter. And I want to ask you to sort of break that down into physical symptoms, maybe some thought distortions that go along with anxiety, anxious behaviors, any other flags that we should be watching for. Can you take us through those?
Sure. Well, I think when it comes to observations that you can make as a loved one, really, when you start seeing your loved one avoiding situations, Jeff, I think that that's maybe the most obvious because what we see most of the time is on the outside. And so behavior patterns are some things that loved ones can look for. And I think it's often very natural to be concerned. If somebody is maybe not going to work or skipping the gym or, not wanting to go down to get the groceries. There are so many places where I've heard loved ones say to me, hey, I noticed that about 3 months ago, and I was wondering what was going on. It's really important to feel like you can ask your loved one how they're doing. Hey, I noticed that you were changing some of your behaviors. Can we talk a little bit about that?
What about this notion of thought distortions? We sometimes hear about black and white thinking or catastrophizing and whatnot. What might we pick up on in conversations with our loved ones, for example?
Yeah, that's right. Well, I think you said it very well there. The all or nothing thinking is something that gets more and more common for people who have the anxiety symptoms persist. And as you live in a way that you're not talking about your symptoms, a lot of those thoughts can fester and they build. And so it starts feeling like it's all or nothing, meaning that, well, it's never going to get better anyway, so why should I even bother? Well, those are the types of comments that we do want to pick up on as early as we can. Earlier intervention helps. So those are some of the comments that you might hear from loved ones, that would be helpful.
Let me circle back to something you just said, Mark, and that is this pattern of avoidance. Can you speak to the notion that avoidance itself is problematic? Because I think for some people it might seem, well, look, if this is an anxiety provoking situation, I'll just avoid it. And that can be taken to an extreme. Um, Why is that not a good strategy?
Well, that's right. It's not a good strategy because what we want to do is we want to encourage facing that fear and being able to, over time, master it. So to avoid it just means that you're not putting yourself in a situation where you can learn more about your triggers and learn more about what is causing the anxiety. And that's what we end up talking to families a lot about, Jeff, is we want to find that balance between not enabling, but also not forcing a confrontation. So this is really tricky for the loved one because that balance is hard to find. But if we enable or if we continue to enable the individual to avoid circumstances, their world becomes smaller. And we want to make sure that we are supportive. We want to find ways to feel as though we can face those anxieties and learn ways to manage the symptoms as best we can.
Let's sort of use that as a segue into some do's and don'ts, if you will, basics in terms of supporting somebody, a loved one or a colleague who is challenged by anxiety. One thought that pops into my mind right away is I'm trying to understand something that might be difficult for us to understand. I think it'd be very easy for us to be dismissive of somebody else's challenges if we just can't wrap our head around why that's provoking anxiety for them. Can you speak to that?
Oh, sure. That's a really good point. I think that the best care is what we consider person-centered care. That means it's very individualized. And so everybody's experience is different. And we have to make sure that we're sensitive to that. It's important to understand that although it may seem irrational, it may seem as though the fear that the person is experiencing, can't be real, but it is to them. And I think that's a really important place to start, is to be sensitive, to be understanding, and have our best opportunity to validate that for the individual.
Can you give us an example of what that might sound like, for example, in a conversation? Again, assuming I can't truly wrap my head around what's making you anxious, and yet I want to validate and not diminish what you're going through. What might I say that would be constructive?
Sure. Well, kind of what you just said, Jeff, I really appreciate, how you described it. So what I would say, what I would encourage somebody to say is that I love you. I want to be here for you. There are times that I don't understand and I would like to understand better, but please know that you're going through something difficult and I'm here for you to help better understand it and help you.
You use this notion enabling through accommodation, for example. Can you talk a little bit more about that? I mean, again, it's a slippery slope. We want to support, but I know that there are times where our best efforts, our best intentions can be counterproductive. Maybe an example of that would be helpful as well.
Oh, sure. Let's see. Well, what you're describing happens all the time. And, as loved ones, what we want to do is be there and we want to make sure that we're as supportive as possible. And sometimes, especially in the heat of the moment, the path of least resistance is the easiest way to go. So let's take, for example, maybe somebody who has been having more and more anxiety about going to work and their spouse is knowing that this is more and more of a problem. They've had some conversations about it. The spouse is trying to be supportive, but yet still not going to work. Well, a morning comes and the spouse says, well, I just can't do it. I can't go to work. Can you please call in to my boss for me? And of course, the loved one is going to want to say, yes, I'll do whatever it takes to help you. However, that's the place to be able to stop and be able to talk things through and say, no, let's find a way to make sure that I can be more supportive to you. Maybe you should make that phone call today. Or perhaps we can try to do a half day today to go into work and I can be here for you when you come home after to make sure that we talk about it. That's an example of where somebody's world can become smaller and smaller the more we accommodate and enable. So it may not be the best example, but it's one that came to mind for me.
And Mark, what about the flip side of that? I assume it's possible to push too hard sometimes when somebody's not ready to take a step. This all gets very tricky, and this is why we're going to talk about bringing professionals into the mix as well. But talk a little bit about the flip side of that. Again, this notion of pushing more than it would be helpful or constructive at a given junction.
Right, right. I think we mentioned it earlier, forcing the confrontation, that's not a good strategy either, because then that ends up impacting the relationship. And
Sure.
as we talk about, values and the things that we cherish the most, it really is that relationship that needs to stay firm and strong. And so forcing the confrontation, or in this example, forcing the spouse to just go to work, go deal with it, that ends up causing a lot of impact, negative impact on the relationship, which is one of the vehicles, ironically, that we really need to stay, strong and unified.
I want to move fairly quickly into treatment in terms of how we might support somebody getting into treatment, finding that treatment, supporting them through treatment, and so forth. Before we get into that supporting role again, let's talk about the treatment process for anxiety and anxiety disorders. What does that typically look like?
Well, there are different levels of treatment, so we should kind of take a minute to talk about that. Traditional outpatient treatment is really connecting with a therapist, a licensed therapist in the community. Could be a social worker, a psychologist, mental health counselor, somebody with experience working with anxiety. And so that's typically where we see some of the first interventions for somebody, is in the outpatient therapy domain. And that typically consists of a session once a week, and you make some good progress in that way. The next level of care might be more intensive outpatient. There are some programs out there that can be 2 to 3 days a week for a couple weeks, where you learn more about the strategies to manage anxiety. And then the next level of care would be a partial hospital program. Partial hospital programs are a little more intensive. They can be up to 8 hours a day, Monday through Friday, 2 to 3 weeks at a time. Again, pretty intensive, often includes psychiatry, so looking at medications. And then the most intense level of care is inpatient treatment. And usually, inpatient treatment comes when there's a level of crisis. So, for example, criteria for inpatient treatment might include some safety issues, maybe meeting the criteria for making sure that somebody remains safe, being treated for some suicidal thinking, for example. So those are the different levels of care. And I think that I hope it's helpful to the audience to hear that one of the first places to start would be with outpatient treatment, seeking out an outpatient therapist with some experience treating anxiety.
And let's talk about that treatment process itself. Cognitive behavior therapy. We hear about that a lot, CBT. What does that mean, and how is it relevant for treatment of anxiety and anxiety disorders?
Right. Cognitive behavioral therapy, it's probably the most common mode in terms of treating for anxiety. It offers a lot of tangible tools and skills because, as the name of the therapy suggests, it really is looking at the connection between your thoughts and your behaviors, or your emotions and your behaviors. And so it really is an excellent way of being able to explore that on a one-to-one basis with a therapist who has experience with CBT. And offers a really a nice opportunity to get some tangible skills, things to practice, to be able to understand yourself better, some of the ways that you think, and how that relates to your behaviors.
So when we talked about thought distortions earlier, for example, black or white thinking, for example, does that fall under the CBT umbrella?
It sure can. Yep, absolutely. And can be very effective. It's a great way to help the individual to reflect on that, understand that maybe this is distorted. Maybe there are some things that I should check here. And it's a good sounding board, a good opportunity to really think differently about the way that they're viewing a certain situation.
Okay, so if that's the cognitive part of CBT, what does the behavioral part look like in terms of making adjustments to one's behavior around anxiety?
Oh, that's right. So then it becomes important to consider, what behaviors can I change? What am I doing now actually that is causing me to change some of my behaviors, like we had talked about earlier. Maybe I'm avoiding certain situations. Maybe I'm skipping my exercise routine. Maybe I'm not sleeping that well. So there are certain behaviors that can be viewed as places where we can make adjustments and changes to be able to complement the ways that we're trying to change our thinking as well.
There's another term that we often hear around anxiety treatment, and that's acceptance and commitment therapy, or ACT. What is that? How does it piece together with cognitive behavioral therapy?
Sure. ACT is another very common way of being able to address anxiety. A lot of outpatient therapists and others will use ACT in a way that helps to complement some of the principles of CBT. So with ACT, acceptance and commitment therapy, there is a level at which the therapist and the client just acknowledge that, okay, this is a difficult situation. And what we want to do is pursue this in a way that really prioritizes our values. So with ACT, what we want to do is take a look at some of the other activities, some of the other relationships, other than the particular stressors that are more valuable to the individual. So for example, maybe work is the stressor, but the relationship that the marital relationship is really strong. Well, placing more value on spending more time with your spouse, it becomes a really important part of ACT, where we're prioritizing the values that are healthier.
So now that we know what treatment looks like, and we appreciate that overview there, Mark, let's talk about helping somebody find that therapy and get through that therapy, and how we might support them during that whole process. And let's start with this basic question: how do we, as a loved one supporting somebody who's dealing with anxiety, have a sense of when professional help might be warranted?
Sure. So some of the signs and symptoms that we were talking about earlier, Jeff, some of the behaviors that we're noticing in our loved one, avoiding things, more isolation, and then some of the other thoughts that we were hearing from the individual, like the all or nothing thinking, and then also some of the physical symptoms, right? Because we know about panic disorder and some of the physical symptoms that come with that. So it could be racing heart, or palpitations, or sweaty brow. So these are all some of the signs and symptoms that we would want a loved one to pay attention to. And then if they're persisting over, I don't know, 2, 4, 6 weeks, then it becomes something that should be considered. Okay, why don't we talk more about this? Why don't we talk to somebody about accessing some professional help? And
Can we? I'm sorry. Go ahead.
and that can then come in the form of a lot of different directions. A lot of people, unfortunately, don't know how to take one of those first steps. And so we often will encourage people to work through their primary care doctor. Sometimes there are therapists that work alongside the primary care doctor in an integrated way. That's an important way to access care. But in Massachusetts, recent developments around a behavioral health helpline have been really encouraging, so that people can make a phone call, talk to somebody, and begin that process of connecting with the appropriate therapist.
This, of course, is a very individualized, personalized experience for somebody supporting somebody with anxiety. But generally speaking, can you help us with some big picture do's and don'ts when it comes to helping a loved one find treatment? I mean, for example, I assume that there are times that it is not appropriate for someone to make an appointment for somebody else. What are some of the basic do's and don'ts here?
Sure. Well, encouragement, positive encouragement. I think that sometimes it's important, especially if somebody has never been involved in any type of mental health care. It's important to recognize that it doesn't have to be forever. It can be a temporary thing. Like, for example, sometimes we just encourage people to just go for a check-in. It's almost like, your annual appointment with your primary care doctor. Just checking in with a mental health professional, kind of getting an opportunity to talk about how you're feeling, checking your symptoms, and getting some feedback from a mental health professional about, well, Yeah, these are certain signs and symptoms of something that can be addressed, and this is how it could be addressed. Just information, knowledge. Sometimes that's the first foray that can be helpful.
So what if my loved one is reluctant to do this and perhaps is insistent that he or she does not want to go to treatment? Um, what are some guidelines for how hard I can push on this front and where I'm crossing a line?
Right. Well, that is a tricky one because as we had talked about earlier, that relationship, that bond that you have with your loved one really is very important. And we don't want to risk that being something that's broken or negatively impacted. So, what we want to do is certainly encourage, point out some of the places where we are concerned. Um, just some of the things we had talked about earlier, Jeff, about I've noticed this. Can we talk about how I've noticed that you've been avoiding certain situations? Is there anything that I can do to help? Those are all really healthy conversations, but as you point out, it really becomes that person's decision on whether or not to pursue treatment. What we'll do is talk to that loved one and say, well, if they're not ready or willing to participate in their own treatment, we would encourage you to go and seek, your own professional guidance on how to handle this situation, how to best support your loved one. It's not really, it's difficult to give generalized comments about that, Jeff, because as I mentioned earlier, it's so person-centered. But I
Sure.
but I do encourage loved ones to seek their own treatment, to then strategize and talk to a professional about how to engage that person in treatment eventually.
As you know, Mark, we tend to have a lot of clinicians in our audience for this educational video series, and I want to ask you to speak directly to them right now in terms of and any thoughts for incorporating the support of a loved one into the therapy that they are overseeing.
Right. It becomes very important. I think that support from the loved one in the treatment experience is something that we all would like to see happen. And so it's really important for the client, the identified client, to feel comfortable with that. So as professionals, we all know that it's important to establish that rapport, that alliance with the client. And in so doing, gaining some trust to the point where even if the client is resistant, the idea that we could invite the loved one in for a session, just to have an opportunity to include them. One session can make a big difference. It can really bring together, it can feel more collaborative. And a lot of identified clients are actually pretty resistant to that. Their world is closing and they want to, protect themselves. But I do encourage that, and I do often encourage the client to sign a release of information so that their loved one can be involved, not just for that one session, but collaborate whenever it's needed.
What about post-treatment? After somebody has been through treatment for anxiety, there are obviously continuing challenges to some degree. What can a loved one or a colleague do to be of support in that situation on an ongoing long-term basis?
I think that's a good question. I think that it's important to recognize what was good and what was not good about the treatment experience. And hopefully it was good. And I think that taking an inventory of that and being able to reflect on that, being able to share with your loved one, hey, I remember that session that we were at together. That was really helpful. Maybe we should return to that therapist. Maybe we should call him or her up again, because I'm noticing some of the same signs. So I think, typically this is not something where, you go through 8 sessions of therapy and everything is fine, everything is fixed. This is an ongoing, project in terms of managing symptoms and recognizing when things become more intense. So I definitely hope that loved ones will return to the treatment and say, hey, I remember that being helpful. I'm noticing some signs and symptoms that make me feel a little bit worried about you. Maybe we should return to the treatment.
Let's shift gears and zero in on something very specific, and that would be panic attacks. And that can be very scary for somebody supporting the individual who's going through that process. Um, what would you like to share on that front in terms of the process itself and how one might be of support to an individual dealing with a panic attack?
That's a great topic to bring up, Jeff. It is really hard. It's very difficult to see somebody go through such distress. There's not a whole lot that somebody can do in that moment, except to just be supportive, to validate, to say, I want to be helpful. I think that it's important to try to, if you can, remove yourself from, remove your loved one from whatever stressful situation where you're in. Oftentimes just getting outside can be helpful, right? So maybe the panic attack is occurring in a situation that you can leave that particular environment, get outside, get some fresh air. It's really important to validate, even though it may feel as though it comes out of the blue. It's really hard to explain. It's very hard to understand, but that's where the sensitivity of just knowing that that's a real experience for that person is very, very important, and that can pay dividends.
Let's talk about a couple of special considerations here, and maybe we start with parents. Um, what would you like to share to parents or share with parents who are watching right now and are dealing with an anxious child? Anything in particular about the parenting role?
Sure. I think probably first and foremost is the modeling behavior, to stay calm. And like I said before, validating and helping the child feel as though they're doing their best to understand and to be supportive. And then I guess, it's really important to stay calm yourself, not get upset, not say things that would feel demeaning or ridiculing of the child. It's tempting to get frustrated, right? But I think it's most important to stay calm, supportive, try to be understanding. And then, once you have that opportunity to talk about the concerns that you have, bringing up examples, saying, I'm concerned about this. Why don't we just make sure that we talk to the therapist about this particular example?
Communication sounds like it's very key in that process.
For sure.
Yeah. And then how about educators? A teacher in a classroom, a coach, others in supporting roles that are noticing anxiety in students. What suggestions do you have for them that might be constructive roles for them to play?
Sure. I think, again, collaborative efforts are probably most important in these situations. So if a teacher or a coach recognizes these things in the school, I would encourage them to speak to the guidance counselor in the department and, make sure that if there are some already established plans for that student, that they feel like they can participate in those and be knowledgeable and do the best that they can to support that. If it's not something that the guidance department is familiar with, then I think it's important to make sure that we introduce, the idea that, hey, we're noticing that this student is more avoidant, having difficulty in the classroom, demonstrating some of the symptoms of anxiety. Hey, can we talk about this? And is it possible that the guidance department could reach out to the parents and guardians?
Mark, there is another layer to all of this that we need to talk about, and that's self care, because you've touched on this a little bit in our conversation so far. But supporting somebody with anxiety can be very anxiety provoking in and of itself. And of course, it's very important that we, as those playing the supporting role, take care of ourselves as well. So, can you help us with some self care basics and how they might apply in this situation?
Oh, sure. Yeah, self-care is important for all of us. No matter what the stressors are, self-care can be one of our best methods of taking care of ourselves. So when we're noticing stress in our loved ones, it has such a strong impact on ourselves that it's important to take care of ourselves. So, for example, just making sure that we maintain some of the basics. That includes healthy appetite, sleep, some exercise, getting outside. I can't emphasize that enough. Getting fresh air is really important. And more than ever, no screen time. Take breaks from technology. really important to consider the impact that all of our screen time has on us. We're always tempted to do a Google search on the latest symptoms, and I guess I would encourage everybody to really balance that with some tech-free time. Really important to consider that.
And again, there are thresholds here, and I'm wondering at what point that threshold might be crossed, at which point somebody would seek professional help for themselves as the supporter. Can you speak to that?
Yeah, I think the level of frustration is probably what I see the most. There are times that the loved one just feels so frustrated and so aggravated that what spills over is anger. And that's where I really feel is that we have to remember the value of the relationship has to be more important than the actual addressing of the symptoms. So let's take care of the relationship, and that means doing what you can to um, control your own emotions, stay calm, not get too frustrated, not get too agitated or angry. So when you're noticing that spilling over, that would be a sign that maybe you do need some of your own help and some of your own chance to get support, strategize, think about how to best support your loved one.
So before we let you go, let's talk about potential resources for somebody watching right now, and again a supporting role of trying to help somebody navigate anxiety. Do you have books, organizations, other resources that you might point people to that would be helpful for them?
Oh, sure. Yeah, I think that what I mentioned earlier, the Behavioral Health Helpline in Massachusetts, really, really helpful. I can give the phone number now if that would be helpful, Jeff.
Sure.
Okay, sure. 833-773 2445 in Massachusetts. That's a really great resource for everybody to be able to talk to somebody on the phone about your current situation, and get potential resources for care. Now, in terms of other resources, Jeff, that you mentioned, there are plenty of websites out there to consider. I think that the National Alliance for the Mentally Ill offers a lot of great resources on their website, so that would be one place to consider. But then, of course, our own team, McLean Hospital and Education Outreach, offers a lot of great resources for us on our website at McLean Hospital.
Mark, I want to thank you for spending some time with us today and helping us better understand how to help somebody living with anxiety. It's such an important topic, and we very much appreciate your time.
Oh, my pleasure, Jeff. Good to see you again.
Likewise, Mark Longstow. And to those of you watching, thank you for your interest in our educational video series. We hope you'll come back for future sessions, and we wish you a wonderful day.